that you have the coronavirus, what should you do? The first thing to do is to check our website and see what are the criteria of a person at risk for the coronavirus. Now, the first thing you need to have to be at risk for the coronavirus is you need to be ill. So currently, we are testing people who have an acute respiratory infection, so they have respiratory disease that's come on quite suddenly with fever or cough or shortness of breath or a sore throat. If you're ill, then you need to look and see if you have any of the other criteria. And these criteria include, have you traveled from a country where coronavirus is circulating in the community? Or have you been in contact with a suspected or a confirmed case of the coronavirus? Or are you a healthcare worker in a healthcare facility where patients with the coronavirus have been seen? If you meet any of those criteria, then you qualify to go for the test. The last criteria that you might meet, but in this case it wouldn't really be your decision, is if you're admitted to hospital. Even if you don't have any of those what we call epidemiologic criteria, so even if you haven't traveled or contacted someone with the virus, if you're admitted to hospital with pneumonia, you should also be tested. And that last one is really to make sure that we don't miss any cases that aren't in any of the other groups. And very importantly, those criteria are updated all the time. Right now, the cases that we are seeing are really in travelers from areas where the virus is circulating and in their close contacts. But as the situation progresses, the countries where the transmission occurs will be updated, and also the criteria may be updated, and so you should always check our website. Once you've decided that you do meet the criteria and you need testing, what do you do next? So the first thing to do is to liaise with a healthcare worker to arrange to be assessed by that healthcare worker for them to also decide, do you meet the criteria, and then if it's needed, have the test. And importantly, we know there's a possibility that if you're coughing and sneezing and you have the virus, we don't want you to go and mix with a whole lot of other people in the doctor's waiting room. So if possible, you should call ahead to your GP and tell them over the phone, these are the signs and symptoms, I'm worried that I've got the coronavirus. And they will either tell you, how to get to their facility in a way that you can be separated from everyone, or they might refer you to a laboratory or somewhere else where you could have the test. If you're using a public healthcare facility, then what you should do is really identify yourself immediately to somebody in charge and tell them that you're concerned about the coronavirus so that they can isolate you and separate you from everybody else. The next thing is to be assessed by that healthcare worker who will make the decision if you need testing, and to make that decision, they can also phone our hotline if they're not sure what to do, which is for healthcare workers, and get advice. And then if it's agreed that you need the test, what they will do is take what we call a swab from the nose and the throat. So the test we do for the virus looks for the virus in the respiratory tract where the infection is. So they'll take a swab from your nose and throat and send it off to the laboratory to be tested for the coronavirus. While you're waiting for the test result, it's very important that you go home and you self-quarantine and limit your contact with others until you have the results of that test, so that if you do have the infection, you don't spread it on to other people. And then your healthcare provider will provide you of the result, and if it's positive, there'll be a number of actions to make sure that you get the proper treatment and that all of your contacts are followed up. And if it's negative, then depending on the situation, you may be able to go about your daily activities. But if you are a person who's traveled back from a high-risk country, or you are a contact of confirmed case, you will still need to complete those 14 days of self-isolation, even if you've had a negative test. And the reason is that even if the test is negative, you could still be incubating the virus and it could come positive at a later stage. So even having a test in those 14 days does not mean you can be released earlier. If you are in one of those groups who need to self-isolate at home for 14 days, you need to stay home and continue self-isolating even if the test is negative.
If you develop symptoms of respiratory illness, including a cough, fever, and shortness of breath, you must seek medical care early. It's important to call your doctor first, self-isolate, and advise on your travel and contact history. If you would like to know more on anything relating to COVID-19, call the General Public Hotline at the National Institute of Communicable Diseases on 0800 029 999, as well as 0800 111 132, or log on to www.nicd.ac.za.